Professor Muhammad Ali Fatih said the federal government has continued to invest heavily in the health sector, particularly in basic healthcare services and disease control programs, with a strong focus on measurable results. According to him, over the last 3 years, the government has expanded primary healthcare centers across the country, equipped with the essential medical commodities and equipment, improved immunization coverage, strengthened antenatal care services, and promoted safer delivery for mothers and children.
So, in the last 3 years, we've been expanding along states, investment in primary healthcare using the Basic Healthcare Provision Fund and others like Impact, making more primary healthcare centers functional. I think almost 14,000 primary healthcare centers are functional right now.
Speaking at the summit, the chairman of the Nigeria Governors Forum and governor of Gombe State, represented by the governor of Nasarawa State, Abdullahi Sile, emphasized the need for northern governors to work collectively towards improving health and education outcomes in the region. He urged members of the Northern Governors Forum to consider proposed legislation to the National Assembly aimed at addressing and ultimately ending the Almajiri system in northern Nigeria.
Let the Arewa Consultative Forum, let the Northern Governors Forum, let the Nigerian Governors Forum, let our traditional rulers, let some of them from the federal come together and propose a bill to the National Assembly to terminate it for entire Nigeria. And that is the only way we can do it.
Also delivering a lecture on health, the coordinator of the Africa Health Budget Network, Dr. Aminu Magashi Garba, called on stakeholders to move beyond discussions and implement practical solutions to address challenges in the health sector. He noted that observations by the Minister of Health require urgent attention and advocated for a declaration on a state of emergency in the health sector to improve the country's poor health indicators.
This is one of the second one, that in northern Nigeria by tomorrow or today we should declare emergency on the health sector across everywhere to ensure that we work together as a team to really improve this poor indices. And the last one I will also mention is the out-of-pocket expenditure need to be reversed. Our government must commit funding annually and we must release that funding. Sometimes we allocate 16% of the total budget to health, but by the end of the year, we are only reporting 2-3% of expenditure or disbursement.
Several papers were presented during the event, focusing on strategies for improving health and education as key pillars for human capital development and sustainable economic growth in the region. Zahra Nasir, Global TV News.